We are LifeSphere, and today we will present our idea.
Okay, so our idea is Nanopod, the mobile clinic. Today we are facing with the dilemma of balancing between healthcare advancement and environmental sustainability. For perspective, the healthcare sector alone accounts for 4.5% of the globe's total greenhouse gas emission. This not only affects the health of the communities they serve, but it also contributes to climate change, which is a very hot topic nowadays. Therefore, we want to talk more about our innovation, which is the mobile clinic aforementioned.
First, let me define a mobile clinic. A mobile clinic is a clinic that is designed to be able to move around and deliver healthcare services to patients in different locations. Let me give you a brief description. We imagine combining electric bus, such as VinBus, and a compact healthcare unit. The mobile clinic integrates telemedicine, helping nurses and healthcare workers to connect with experts all around the world, making diagnosing more accurate, timely, and easy. Ideally, we also wish to install AI-powered diagnostic tools that help to improve the speed and quality of health checkup and scanning. So, how does our product positively affect the environment? We, the creators, have brainstormed three major benefits, which are first, to reduce the carbon emissions, necessities of patients to travel. Second, to offload the hospital treating waste process. And third, to promote the sustainability by utilizing green materials.
A research conducted by the WHO has shown that up to 80% of health concerns are non-critical, which means that they can be managed effectively without the need for hospitalization. Nanopod will reduce the environmental and economic burden associated with the access of healthcare. This is especially beneficial for the people who live in remote areas where travel is costly and time-consuming. And by bringing healthcare services to the doorstep of these patients, Nanopod will help to alleviate these burdens significantly.
By using mobile clinics, we hope to help to reduce the amount of hospital waste that currently needs to be processed. To do so, we will adopt a multi-bin system, including separate bins, label different kinds of common medical waste. This action will encourage classification, which is a vital part of the process. Let's assume we use VinBus for this purpose. Naturally, we will combine a charging station with a collecting waste station. Therefore, when the electric vehicle comes back to the station, it will also transfer the waste that is accumulated throughout the day.
So a pivotal advantage of deploying electric buses, such as VinBus, as she said, is that they will help to significantly diminish the necessity for new hospital construction, since the production of conventional building materials, such as brick, cement, and concrete, is not only resource intensive, but also a major source of pollutant. Our solution will present a dual benefit. First is that they will bring healthcare services closer to the underserved population. So, for example, it's the people who live in the mountainous area. And the second is that they will lower the environmental costs associated with the expansion of medical facilities. Moreover, our clinics will be powered by solar panels. This enables them to harness clean, renewable energy, and this not only conserve energy, but also make sure that the pods themselves contribute to a reduction in greenhouse gas emission.
So finally, how does our product benefit the investor? First, it combines two values: improved access to medical care to the less advantaged, while still cutting down on the environmental impact of the medical activities. Second, as our product integrates telemedicine and AI-powered diagnostic tools, it also have a potential to become a transnational product, which we can also sell to other markets having similar problems like Vietnam, which is quality medical care only concentrate in big cities. And third, our mobile clinic is designed to be environmentally friendly and community-oriented, so that it will help the investor to approach to green loans following the world's trend zero carbon by 2050. Thank you for listening.
Thank you so much for your fascinating ideas. It's very innovative. And I have two questions for you. First of all, where can you get the financial support regarding the massive the workload to execute this solution of yours? Secondly, you did mention healthcare professionals. Nevertheless, from where and how can you recruit them? Or will they be volunteering? How can your networking help? Thank you.
Okay, so I will answer the first question. It is financial support. Actually, our idea is not a non-profit product. We will also charge patients, but only in big cities, and we use and maybe we account 8 to 9 patients will reach the break-even point of us, and then after the ninth patient, we will use the profit that is gained to operate campaigns for free to treat for minority populations, so that we can get the financial by our own. So in the second question.
Okay, so I will answer your second question, which is how will we recruit the human, like the healthcare provider, and how would the network help the healthcare, right? So the first question is regard of the recruitment. So we have thought of two ideas. The first two sources that we can recruit from. The first one is volunteer, because there is a lot of volunteering organization around the world. So we want to take advantage of that, and we can deploy the doctors and nurses and healthcare provider to the very extreme region climate that lack healthcare medical facilities. I'm sorry. And the second one is we can still recruit traditional healthcare worker with a higher price, and this higher price will be compensated by the money that we take away from the people in big city, and we will increase the salary for these workers so that they can be compensated adequately. And the second question is regarding the network, right? So we did mention telemedicine, and we think that telemedicine will be one of the most popular growing trend in the next decade, because it helps people, especially experts and doctors from around the world, to diagnose for one patient, which provide multiple point of view and multiple opinion from expertise. And we think that this will result in better healthcare. Thank you for your question, and we are done.